For the first time, researchers are saying a baby born with HIV has been functionally cured of the disease, meaning only small traces of the virus can be found in the child's system and no further treatment is necessary. The case was reported at a scientific conference in Atlanta Sunday. The New York Times called it a startling development that could lead to more aggressive treatments of babies infected at birth and a sharp reduction in the number of children living with the virus that causes AIDS. The child, whose name has not been released, is only the second person to be cured of HIV. The first was Timothy Brown, the famous Berlin patient who lost all traces of the virus after a stem cell transplant. The baby's story is a little complicated. The child was reportedly born to a mother who has HIV, and doctors quickly confirmed the baby also had the virus. They began an early and aggressive treatment, but then both mother and child disappeared. NPR quotes the doctor saying, "The baby's mom was having some life changes. That's about all I can say." They lost track of the child for over a year before state health authorities tracked the mother down. When they finally were able to test the baby again, they couldn't find the virus. The doctors couldn't believe it and went back to review the earlier test to see if maybe there had been a misdiagnosis, but they finally found traces of the virus using extremely sensitive tests. So the big question is, what do researchers think caused the child's recovery? A CNN medical correspondent breaks it down.
This baby got drugs very quickly, second day of life, and got high doses of 3 drugs. And they're thinking that maybe was the difference. The quickness, the drugs, and the dose of the drugs.
Usually infants suspected of having HIV are treated gradually with low doses until doctors are sure they have the virus. The doctors think by treating this child early, they were able to deny the virus a foothold in the body. The Wall Street Journal tells us this could be a game changer. If further study confirms that very early treatment can cure HIV-infected newborns, it could spur widespread use of such an aggressive regimen in babies born with HIV, nearly all of them in low and middle income countries. While relatively few children are born with HIV in developed countries, there are hundreds of thousands of cases per year in other parts of the world. The now HIV-free child is reportedly in good health. For Newsy, I'm Christian Bryant. Multiple sources, a broader view.